we may have to uncover your body and expose some parts of your body. And I want to make sure that you're okay with that. I will do my best to protect your privacy during this whole assessment. Will that be okay? Okay, great. Can I go ahead and get your name and your date of birth, please? Okay, I'm just going to check your wristband to make sure that that information matches the wristband, and it does, so that's great. I'm going to go ahead and I'm going to lift the bed to a good working height to make sure that I don't put any strain on my back, and then I'm going to go ahead and make sure that the head of the bed is flat for the fundal and the uterine exam. At this point, I'm going to go ahead and assess the breast. I'm going to make sure that the breasts are soft and filling. I'm going to check the nipples and the areola, make sure that there is no cracking, and make sure that the skin is clean, dry, and intact. I could also use this time to educate the patient if she is breastfeeding. Let her know that she needs a good supportive bra, and for bottle feeding mothers, let them know that they need a tight fitting bra that is going to reduce the stimulation to the nipples and the areola. So at this point, I'm going to go ahead and do the abdominal assessment. So I'm just going to uncover her a little bit so that I can expose her abdomen. Now, she did not have a C-section. She had a vaginal delivery, but if she did have a C-section, at this point I would go ahead and assess, make sure that it's clean, dry, and intact, make sure the edges of the incision are approximated, and I would go ahead and make sure that there's no redness, no swelling, no warmth, no drainage, anything like that. Look for signs of infection. So after I would assess the C-section, at this point I'm going to go ahead and listen to, use my stethoscope and listen to all 4 quadrants of the bowels to make sure that we can still hear the bowel sounds. So after the abdomen assessment, I would also go ahead and assess the fundus. I'm going to feel for the fundus, check positioning. If it feels deviated, I would go ahead and make sure that the patient could void. A lot of times that can affect the placement if they have a full bladder. So I would also use this time to go ahead and ask about bowel movements, consistency, if there were any pain with the last bowel movement. I would also ask about urination, if there was any urgency or burning or pain with urination. And then, of course, the last time that the patient has urinated. So after the fundal exam and the positioning, and we determined the positioning and all of that, then I would go ahead and I would move to the lochia. The lochia, it should be, at this stage, she's 2 days postpartum, so at this stage it would be normal for the lochia to be rubra, and that is going to be a dark red color. I'm going to assess to see how much lochia is there. It would be, on this patient, she's got a moderate amount. As long as the patient's not completely saturating a pad within an hour, that's considered normal. So once we assess the lochia, we're going to assess how much of the lochia that there is. We're going to assess the color. We're going to assess if there are clots present, and we're also going to assess the odor of the lochia. A foul-smelling odor can mean that there is some sort of infection. So we're going to note for any of that. This patient does not have any of that. She is fine. So after the lochia, we're going to go ahead and we're going to assess the extremities. I'm going to check the pulses in the arms, make sure that they are strong and equal on both sides. I'm going to also assess the legs. I'm going to check the popliteal pulse. I'm going to check the posterior tibialis pulse and the plantar pulses on both sides to make sure that they are equal and that they are strong. I'm also going to assess the lower extremities. I'm going to be checking for redness, warmth to the touch. I'm also going to be checking for any edema that may be on the patient's lower legs. This patient has no warmth, no redness. She has strong pulses on bilaterally and strong equal pulses bilaterally. And and there's no edema or anything like that. After the extremities, I'm going to go ahead at this point and I'm going to uncover the patient. I am going to assist her onto her side. And at this point, I'm just going to go ahead and assess the posterior area of the body. I'm going to check the epidural side. I'm going to make sure that there's no leakage, make sure that there's no bruising, make sure that there is no, irritation, edema, anything like that. I'm just going to check for anything abnormal with the epidural side. Now moving on down, I would go ahead at this point and also assess the anal area, make sure that they're check for hemorrhoids, make sure that if there are hemorrhoids present, we know how many are present. I can also use this time to check the bed pad to make sure of the lochia that's on the bed pad or discharge. Check the color, the amount. You can also weigh those pads. At this point, I'm just going to go ahead and assist the patient back over on her back. And I'm going to go ahead and I'm going to cover her back up to respect her privacy, making sure that she's comfortable. And I'm going to ask if the patient has any questions. She does not have any questions, but I am going to use this time after the assessment to go ahead and perform my patient teaching. The things that I'm going to be teaching this patient to look out for is her temperature. I'm going to make sure that she knows that if her temperature gets above 100.4, that she needs to contact the provider. I'm also going to make sure that she knows what to look out for with the lochia, to make sure that she knows if her lochia goes from, say, rubra to serosa back to rubra, that's not good, and that she needs to let the provider know those findings. And I'm also going to let her know that if she experiences any severe or persistent abdominal or perineal pain, that's something she also needs to let the provider know. And so there's no further questions. The patient is comfortable. The call-out is within reach. She has everything that she needs. I'm going to go ahead and go back to the nurse's station at this